if I can, Chair. So what you're saying is additional mental health support and provision wasn't available. It was just through their own GPs.
Through the emergency planning process, the on-call gold commander for the NHS on that period is aware of that incident, and they have plans in place and put plans in place to deal with that. And if they felt, and again, it's an answer, it's a question I haven't specifically asked that gold commander, in fairness, Councillor Norbury, and maybe that's a question we should ask. But ultimately, there was, in terms of this report, a recognition that they, in terms of those people who provide that mental health support, maybe could have done more in terms of that. So with that, does that, I suppose from my side, does that mean that they weren't there in place? Yeah. There were frontline medical practitioners in place for the acute phase of that incident. And when we talk about private locations people to go to, people went into the back of ambulances to have some of those conversations.
The bit we were involved in was the practical bit, where it wasn't to do with the medical condition.
Speaking as a survivor of an explosion myself, where I was in a blast-proof room, which I was in there with the blast and the fire. I was on fire. I fully appreciate how PTSD works. I've had PTSD. You might say I've still got PTSD. That is the way it works. I don't think for 1 minute the people who are suffering with a mental condition, and I'm agreeing with Councillor Norbury and Councillor Muspratt here, are going to trot off down to the GP surgery and say, I'm feeling a bit rough after that, I'm not quite myself. It has to be an automatic support mechanism, because the local GP hasn't got the facilities to support that. The local NHS isn't going to be able to support 120 people with mental health issues turning up next day. And we need to have some kind of plan around that. And it really is important, because if you sort it early enough, people will make a quicker recovery, and we will be in a better situation 3, 4, 5, 6 months on, because the people will be in a better position 3, 4, 5, 6 months on.